Hi everyone. Today's podcast is about white phosphorus and its use in chemical warfare. This is not a political podcast. This is more for educational purposes to have a general idea on how to treat one's um, um, being hit by such a calamity. So for that, let's get started. So what is white phosphorus? It's used as a burning element in ammunitions. Lately, we have been seeing a lot more use of it during the wars that have been taking place, including the Russia-Ukraine war and the war in Gaza. It is pyrophosphoric, meaning it is ignited when it is contacted with air, burns fiercely, ignites the clothes, fuels, and so on. It can react by producing an immediate blanket of phosphorus pentoxide vapors, which are irritants when inhaled. It can commonly be used as smoke in grenades, in infantry fire, ammunitions, and bombs. It has been used in many wars, particularly in the U.S. Forces. They used it in Vietnam. Here's a picture of supposedly a picture of a white phosphorus bomb from the use in Vietnam. This one is reported as from Lebanon with the use of white phosphorus there. And here's is reported to be in Gaza. So white phosphorus is not necessarily banned under international law, but it is regulated. It is illegal to use in civilian areas or civilians where they are residing. But unfortunately, it is something that is commonly used. We see a lot more news reports about it, and I wonder how much of this warning is heeded. There are two types of injuries that can occur with white phosphorus, the most common, of course, being the burn injuries, the ones that are most fatal. Vapor inhalation are also possible where the gases is inhaled and can cause a picture of chemical pneumonitis or injury to the lung, irritation. Some horrific pictures. Here's an 18-year-old boy with phosphorus burns due to a shell detonation. The bottom pictures of it around here shows healing, which is after 18 months of this initial presentation. Here's a cavity burn that was suffered by an Armenian soldier in 2020. And unfortunately, another Palestinian boy with severe burns to his body. And it was reported that he had exposure to white phosphorus. So some things to keep in mind that white phosphorus, again, very important to stress, it continues to burn while it is exposed to air. The particles can easily embed on the human skin and cause serious burn injuries. The burns are typically full thickness, they're necrotic and can cause both thermochemical effects, and the healing is much slower than a thermal burn alone. Continues to burn until it is fully consumed. It is lipid soluble, which means it can penetrate very deep into the subcutaneous tissue, causing a full thickness burn. And if the burns unfortunately are greater than 10% of the body's area, then death is most common. So how can we treat such a catastrophe? Number one, take off all contaminated clothes as soon as possible. Immediately try to extinguish the white phosphorus by depriving it of oxygen. I've seen videos of some people immediately putting sand on it or anything possible to just completely get it deprived of oxygen. Can also be best done by immersing it in cold water. For a human body, immersing in cold water is the best way to go if you can, if possible. Um, the white phosphorus does become a liquid if under warm condition. So never use hot water or warm water to clean that area of the body which is exposed. And similarly, don't do aggressive water irrigation as you risk splashing the white phosphorus particles on the regular tissue or on other people. So it's best to use gentle tap water irrigation. Before irrigating, use a moistened cloth or a gauze to extinguish any burning particles, because splash injuries are quite common and can occur. So here is an example of tap water irrigation, which is gentle water flow, very gentle use of water. This can help prevent splash injuries from any white phosphorus particles that can be on the skin. After a patient has sustained injury, it is unfortunate, but it falls upon the medics or people that are around to immediately debride the sloughed off skin and remove any obvious phosphorus particles that are present on the skin. This needs to be done right away for it to be of benefit. The phosphorus can absorb in the body, can lead to liver necrosis and direct injury to the kidney, leading to kidney failure. There's also been reports of it causing hyperphosphatemia, which is electrolyte abnormalities, hypocalcemia, so EKG changes have to be monitored. And even small burns have to be monitored within the hospital setting, simply because it can lead to significant electrolyte abnormalities within an hour of its exposure. So removing the white phosphorus. So a Polish study was very helpful in this case, found that moistened gauze was highly effective in extinguishing the flames from the white phosphorus. So it's also helpful to remove and absorb a significant amount of white. This also helps absorbing the white phosphorus, by the way, as you put the wet cloth or a wet gauze on top of the area where the white phosphorus is present. If there's any obvious particles, you can of course remove that with the forceps, but it's best to press the area where it is burned, where white phosphorus is most likely still present, to press that area for 3 to 5 minutes with a cool, moist gauze or any cloth. So the following steps are important to memorize and to understand. Remove all contaminated clothes. Try, if you can, to submerge or immerse in cool water the area that has burn on it. Remove all embedded white phosphorus particle by pressing with a moistened gauze or a cloth for 3 to 5 minutes. Any obvious particles can be removed with the forceps. Debride any sloughed off skin. Dress all burn with cool, moistened gauze or cloth, keeping it wet during transport to hospital. And once in the hospital, of course, monitor electrolytes, EKG, for the first 12 hours and watch for any organ failure. This brings us to the conclusion of our presentation on how you can treat white phosphorus burns. As we see more unrest in the world, I think the general public needs to be aware of how to protect themselves, since we are commoners, normal civilians. We are people that don't have much say in this. Unfortunately, they are used to kill enemies, but I think we should be ready for any scenario that may present, and this may be one of them, since it's a commonly used item, a chemical within weapons. I thank you very much for watching.